greetings and welcome our viewers around the world who are watching us on our YouTube channel, of course, directed by PepG Systems, the Ultimate Breakfast TV. You can look it up on YouTube a bit later in the day, and this conversation is also going to be live there, and you can watch it as well. But we're live on Ultimate 106.9 FM and live around the world on ultimate1069.com. We're here with Professor Robert Quansah, Associate Professor in Orthopedic Surgery, and this one is amazing. Let's talk about the carpenter. Even the average Ghanaian worker who is in the office, the banking hall, the journalists, the reporters who are out there on the street, you know, getting stories and all that to tell the rest of the world. What are the risk factors for them? What are the dangers involved in terms of this? So they get to contract waist pain for that matter.
Let's take, for example, an architect. The architect is always drawing in a position with burnt neck and bent upper back, so they tend to get pains in the neck, and especially because they bend over their drawing board in a non-physiological position, they also tend to have back pain, for example. Okay, now let's take traders. I noticed that when I came to Ghana in '95, I saw a lot of traders who had contracted tuberculosis of the lumbar spine. Why? Because when they travel to other countries, for example, Ivory Coast and Togo, they are unable to carry on with their normal regime. The journey is stressful, so their immune system falls, and the bacteria, tuberculotic bacteria in their system regenerates, and they develop tuberculosis of the lumbar spine. Because they lift heavy items, I mean traders, it goes for shopping, and they will carry their load for long distances. They also suffer backache. When we begin to talk about what happens when there's backache, I would explain why they develop backache. Because they lie in positions which are not normal for their body. For example, when you go and see them in the station, they crawl themselves, lie down in very uncomfortable positions. And especially because they travel at night. Those days, the vehicles were not designed to allow you to enjoy your night ride. So they come back and they have all sorts of pains. Let's take somebody at the office like you, for example. Today you are sitting in a swivel chair, but those days you sit on hard, unphysiological, wooden, you see. And so because of prolonged sitting, inactivity, probably when you move from your chair, then you are going to the washroom. All these contribute to non-activity, inactivity, and you can develop what they call it, by not exercising, you are not moving, and you are obese. These factors add up to the risk of developing backache. I'm not talking about other conditions like cancer, the risk of developing cancer, which some of us do. I mean, the education has not gone on that. You can also have back pain as a result of aging. For some reason, the spine begins to age very fast, and so it begins to give you pain. We can have trauma, injury. You hear people fall from a height and they have pain as a result of trauma. So these are the various, some of the disease conditions that can affect the back and give you back pain.
Okay, Prof, just pardon me, let me just go back, especially on the lower part of your body, for instance. Is any pain around the lower back qualified as waist pain? The lower back?
Yes, once you have pain in the waist, you have waist pains. So all pains in the butt, generally when the population complains of waist pains, they are talking about a particular type of waist pains that comes as a result of aging. That's degeneration of the waist vertebra or the lumbar spine, and that is what they refer to as waist pains.
Is it something that's naturally expected? I mean, that's aging related? Is it naturally expected that you get that pain?
The point is that as soon as you are born, you begin to age. Right from your mother's womb, you begin to age. But when the aging is taking place and other factors come into play, they accelerate the aging and can begin to give you unnecessary pain.
Factors like your work, your daily work.
Yes. And this brings when you don't exercise, overweight, when you lift things without the proper technique, those who do hard work. For example, the other time I gave you the example of sportsmen. Unnecessary stress on your waist. For example, when you are smashing, when you are serving in lawn tennis, when you are whacking in your
the ball,
in your golf, or even cricket. You know how these sportsmen suffer greatly from back pain, and also you can have footballers during football matches. They might have a knock or jump and land inappropriately and have back. These are factors that can accelerate and even cause back pain by themselves.
Very well. And if you have any specific issue as far as waist pain is concerned, feel free to share with us questions and your thoughts. The WhatsApp line is 0233-144-199. But, Prof, I know you have statistics. What are the statistics available on this health condition in Ghana and Kumasi, to be specific? How many people are affected by waist pains? Do we know?
I'm unable to calculate. Why? Because it's a fraction that comes to me, and it's a fraction that comes to Confirmation. But worldwide we have statistics. For example, you want to ask at what age does backache start? I want to tell you that I have seen evidence of backache in children, little children.
What causes that?
Well, conditions, inborn conditions of the spine, which cause the spine to degenerate faster than the age of the child. Disease conditions of the waist can cause waist pains in children. And you know, during those days when a child complains of waist pains, the parents think, waist pains are conditions, disease conditions of the old. So how can a child complain of waist pains? And then they begin to use all sorts of local treatment, enema, edepu, amaman, give all sorts of concoction. But the right thing is that the child ought to be taken to the hospital for it to be diagnosed. So we can have backache in children. Backache, when it's coming, does not know any age. But who are at risk? As you grow older, you are at risk. For example, when you are 40 years and above, there is 40% chance that you contract backache. As the age increases, the percentage also increases. So people around 60 years and above, 60% of that group would suffer from backache. And 80, you have 80% as well of the aged above 80 having back pains.
Let's talk about the younger ones and late detection of the need to even go to the hospital. What are the dangers involved here? I mean, you mentioned that some tend to use all manner of ways of trying to ease the pain or even cause it to go away entirely, and usually they are not successful. But that time of realization that, okay, now we need to go to the hospital, what are the risks involved there?
Depending upon the cause of the back pain. For example, if it is the disease of the spinal cord which is developing, if you don't come early for us to detect it, you get paralyzed. Yes. When you come to my clinic, you see a lot of people in wheelchair who are coming late because they did not come to the hospital early and have allowed the actual disease, the primary disease, to overwhelm them. For example, if it's infection, like tuberculosis, yes, you get deformed spine. For example, hunchback. hunchback may be as a result of tuberculosis of the spine. If you come early, now we have modern drugs for treatment of tuberculosis. If you report early, we should be able to help you. If you report early, we should be able to do surgery to save the spine from deformation. Likewise, if you have aging of the spine, if you don't come quickly, you realize that you are unable to do things that you could do. For example, in my survey, 70% of patients above 60 years who had back pain could not do things they would want to do. For example, in Ashanti here, they would want to go to funerals on the weekends, but because of back pain, they are unable to walk. They are unable to sit for a long time. And we have a tradition. After funeral, you should go around greeting. They are unable to do that. Sportsmen, because of backache, they are unable to do their favorite sports. So that if you don't have a pretty idea on how these conditions develop.
Very well. Let's look at the complications of the health conditions again, and perhaps you might want to generalize this time around for us. What are the complications?
Complications?
Yeah.
I'll start from the minor complications and come to the severe ones. This morning, I was reading the latest article on sex and back pain. And I was surprised to have read that the actual scientific data, empirical data on this does not abound, and that what we have been telling people have been anecdotal. But I can confirm after reading that article that one of the early signs is that there is decreased libido and coital meetings.
What does that mean?
Erectile dysfunction.
Okay.
Because when you have waist pains, you don't desire to meet your partner. When you don't desire to meet your partner, there is the possibility of infertility. Because when for a long period a woman does not get pregnant, she develops.
And we're talking both men and women?
Both.
Okay.
Because it says on both parts, both sexes, there's reduced this ability, the desire. Another complication is that you are not able to walk well. When you are walking, you feel that your legs are giving way. The patient will say, oh, announce a chimenai. And it is a police, a chimenai, this is a mjina. Se menjina, meshiase. That will be the typical complaint.
So more like numbness?
Numbness. And so numb that the patient is unable to walk and has to stop and wait for the numbness to go away before. You can also have weakness in the legs, and the weakness can develop into paresis, such a way that you are unable to walk and you would, what they call it, be wheelchair bound. You can have complications like inability to move your bowel. You are constantly constipated. 3 days, 4 days, and when you move your bowel, they are as hard as nuts. When you have, and then you can have deformity of your back. Some patients will come and tell you, doctor, my sugar.
My sugar, and you're slanted.
Yes,
somehow.
Yes. And when we don't hurry up, this deformity. Case of cancers like prostate cancer, if we don't identify the prostate cancer early and it spreads onto the spine, you get paralyzed. When you have disc herniation, you've heard of disc herniation as a result of what they call diseases of the degenerative diseases of the spine, that can also lead to paralysis.
Okay. All right. Shortly, we'll be activating the phone lines, and we'll have you listeners also join the conversation. But let me just get on the WhatsApp console and see if we've got some messages here from our listeners. There was this message from one of our listeners moments ago, and it's got to do with the youth today and how they tend to imitate the hip hop rappers and all that in terms of sagging their pants and walking in a certain way as if they are in a boat, wobble and all that. How does that even affect or even cause waist pain or back pain? Is it even possible?
The point is that when they walk, the rappers, they are in motion. Other than that, you don't see them exercise. Let's be fair.
Yeah.
And so probably that will contribute less to the development of waist pain because they are exercising, exercising the muscles. That would prevent. So I don't see how
that can cause waist pain directly. Okay. Can a waist pain be cured merely by any ointment or concoction without any diagnosis?
We have agreed that waist pain is a sign of a disease. You must find the disease and manage that disease. Painkillers will just take away the pain, not take away the pain, because they would only reduce the pain. So we must find the disease condition and manage it. There is no proven concoction that can cure the disease without diagnosis.
No proven concoction at all. But what about these commercials that we are hearing? Look, this particular medicine can cure, it can help deal with waist pains and all that. These are commercials that we hear, and they say it in such a way that you're convinced that, look, there's no two ways about it. Go get a drug and it will really help. I mean, you're advocating for this now, meaning that a lot of people are at risk.
Let me put it this way so that I don't become controversial. Science does not teach that. They are not in our books. Research does not find that. So I don't teach my doctors, I don't teach my students that there are concoctions that can cure waist pains. In other words, those who patronize those types of medicines probably have their belief in it. I cannot question that.
It's a matter of belief.
Well,
but if people are at risk here, then there's a danger.
There is indeed a danger. Probably that is why we may have to continue with this conversation another time again.
But what do you suggest in terms of policy direction? What do you suggest be done to deal or nip this particular situation in the bud?
Now, let me outline the steps. The first step of treatment of waist pain is a talk with the doctor. Have a chat with the doctor. The doctors know the procedures. After talking with you, they will begin their investigations. Today, Ghana, we have almost all the types of, including MRI. First, we thought MRI was a myth, but now we have MRI in Kumasi, we have MRI in Emina, so that investigating a case of backache and diagnosing it is no more a problem. So, talk to the doctor will take you through the process. If the doctor thinks that it is beyond him, we are around.
Okay, all right. Shortly, we're going to activate the phone lines. I know a number of our listeners have questions for you as well, Prof. And let me just remind you that we're here with Professor Robert Quansah, Associate Professor in Orthopedic Surgery. And this is the Ultimate Breakfast, which is also live around the world on ultimate1069.com. And later, you can find this conversation on YouTube on Breakfast TV channel. We'll be back shortly, and we'll obviously speak to Dr. Samoy, and obviously speak to Professor in Orthopedic Surgery. And this one in our focus have been on waist pain. We've got 3 more minutes to go, and some questions are coming in from our listeners. I'll start with Michael, who is saying that, sorry, I didn't actually get the interview, but I listened to you guys briefly, but I was tied up. But my question is, I had some pain in my waist for 4 months now, and I changed my mattress, and the pain reduced, but I still feel the pain. I can't bend for a very long time, and that's from Michael, Prof.
Yes, that is true. Yeah. Thank you very much. That is very true. Especially when you have very soft mattresses, you lie in them, and they give you improper posture of your body during sleep, and so your body begins to react to the improper posture by signaling pain. Now, what happens is that this must be tackled immediately. If you don't tackle that pain that has come as a result of improper posture, it develops into a disease condition which causes the pain to stay longer or go chronic. So I advise this young man to see the doctor to investigate whether the condition which was positional as a result of the position has become a chronic condition that can be treated. Okay, so you should see the doctor.
Okay, there are more questions coming in, and this one from one of our listeners with no name. It says, at what level can the health condition put someone in a wheelchair, and is there hope at all at that particular point?
Yes, as we're discussing, we're hoping to tackle this the next time we meet. When you have a form of waist pain that is arising as a result of slipped disc or slipped bone, vertebral bone, the bone or the disc compresses on the spinal cord or the nerve. The spinal cord may die or the nerve may die. When the nerve is dead, finish. You are paralyzed. That is why it is imperative that you see the doctor immediately you have back pain.
Okay, all right. I've one of our callers joining us. So Sasibe, he's calling from Esra. So I'll say good morning. Prophet's listening to you. Go ahead. Hello, say. Yes, go ahead.
Back me, but maybe could to go. Could to the bed. Let's say 2 years in could to join me as a Matoto. That could find it in England. Yeah, still, the movie give me that. When I'm just Papa, you don't say, there, which much a day.
Okay. Very well.
Yes, so, what to do here we are? A tresse yaria abba cotojono. Tis a demiti can't chirayeno. Say, Yaba, a tresse yaribi abim. Inte say, Oba doctor, na doctor she, no who yarikwa abba ukotojono. If you say, Ya, a yen century, say, yari wom. Ya nankasa enye yari. Into num dakrofina kuna. Yano and na opesa buffer and yariano into the doctor.
I've also got other questions for you, Prof. How does stress, really affect the spinal cord? Does it even cause waist pain or back pain?
Stress. When you have stress, it exacerbates various conditions hitherto were hidden. Probably you may be having the waist pain, but because of your compensatory mechanism, the state of your psyche, the state of your mind, you are not feeling it. That is why guys don't get sick, because the state of mind is absolutely in such a way that they don't perceive their sickness. It has been found out that people who are stressed are most vulnerable to waist pains. So stress can cause the exacerbation of chronic conditions hitherto which were hidden.
Okay, right. Another message here says the educated African referred to his local medicine as concoction. For him, that's mental slavery, and that's from Victor. And he says, look, there's no way we should refer to them as concoction. But the argument that Prof is putting out there is that look, if you're experiencing pains back, your waist, wherever, make sure you go to the doctor and let's have it assessed. And this conversation, I know Prof will continue some other time, but I want to thank you very much for being here with us on Health Matters on the Ultimate Breakfast, not only on radio but also on the Ultimate Breakfast TV on YouTube around the world on ultimate1069.com. Prof, thank you so much for being here.
Thank you very much.
Okay, so folks, that's it for today's edition of the Ultimate Breakfast and Ultimate Breakfast TV. We came to you live from our studios here in Kumasi and live around the world on ultimate1069.com. My name is Prince. The show is produced by Ato Kwame Hazel with technical support from Lambridge for the matter. And up next here on Ultimate FM is Ultimate Branch and Life.